Thank you, and it's my pleasure and privilege to be here, and I'm glad I made it after so many years. Bill's very persistent, as probably some of you know. He doesn't give up easily, and I'm the beneficiary of that. So, what I'm going to talk to you about is euthanasia and physician-assisted suicide, and you can really treat them together because they bring the same ethical, philosophical, legal dilemmas. And that slide that is there is a slide of the front page of the Globe and Mail, which is our national newspaper in Canada, the Saturday morning after the Supreme Court of Canada on the Friday released a historic decision. It's called the Carter case, Carter versus the Attorney General of Canada. And what it involved was whether the prohibition on assisted suicide was unconstitutional because it breached charter rights to life, liberty, and security of the person. And what you can see what they put on the front page, a step toward kindness. And the writing that's at the bottom there was, it was a day of bittersweet triumph for supporters of assisted suicide, as the Supreme Court's unanimous decision means new choices for terminally ill Canadians and tough questions for families, physicians, and politicians across the country. And in actual fact, the Supreme Court, even though the challenge was to the prohibition of assisted suicide, the Supreme Court phrased its judgment in such a way that it is arguable, and it will remain to be seen, that it actually covers euthanasia as well, because they said that people who were unable to commit suicide also had the right to assistance, and that would be euthanasia, which in other legal terms is first-degree murder. And so that is what we're dealing with currently in Canada. What the court did, it gave the legislature, the Parliament of Canada, because this is federal law. In Canada, criminal law is federal, unlike Australia, where it's state law. And they gave them 12 months to write a new law that would allow patients to have physician-assisted suicide or euthanasia. So it's a very serious situation, and we're sort of traumatized in a way, the people who are against euthanasia, which is what I am. And I was asked to help to draft a law that would allow this, and my first reaction was, no, I won't do that because I don't want to be involved in this. I think this shouldn't be allowed, and I can't see how I can be involved in drafting a law. I've since changed my mind, because if it's going to happen, then to the extent that you can make it the minimal access possible, then I think I do have an obligation to try and do that, and I am involved in trying to limit how it would be available. So let me tell you what I want to talk to you about. What I think is that, because you've got the same problem here in Australia that you're going to be faced with, are you going to end up in the same situation as Canada? And I thought that what I could give to you tonight would be that if we can identify what the pro-euthanasia strategies were that got them this victory in this case, and then how should we respond to those strategies, that might help you. So here we go. So strategy one, and I only realized this one recently. I was at a conference at McGill University, and the politician who'd been a young woman who'd actually been my law student, and in the Legislative Assembly in Quebec, which is the provincial legislature, like the Canberra one here, she said to the Legislative Assembly, I don't think Professor Somerville thinks I was a very good student, because she was the main proponent of getting this passed. and she was doing a debate with somebody who was supposed to be anti-euthanasia. But what she did, and she's very charming and very pretty and young, and, you know, everybody would like to identify with her. And what she did was she started off by saying, well, look, we all agree on most things. And you saw this whole unrolling of we all agree. And where we all agree is that palliative care should be available to everybody who needs and wants it. But the problem is it's not. In Canada, between 16 and 30% of people who need palliative care actually get access to it. I don't know what the figures are for Australia, but I'd be surprised if everybody who needs it actually gets it. And this is a problem, because what happens is the debate starts with, this is where we all agree, and here we go, you know, we all think this is what we need, we want to have palliative care, and everybody says that's right. And so when you then start to disagree with the people who are pro-euthanasia, what happens is that you look as though you're being difficult and you're breaching this agreement that we all have. And so I think that what we have to do as the first, to defeat this first strategy, is to say, well, yes, even though we do all agree on palliative care, that is not what we're talking about here. What we're talking about is whether doctors, and I put it very bluntly, which upsets the pro-euthanasia people, we're talking about whether doctors ought to be legally authorised to kill their patients. That's what we're talking about. And so that, I think that's the first thing. Don't fall into the we all agree trap. You can say, yes, we do, about palliative care, but leave it at that. Don't let the other side go on and on and on about how that's the right thing to do. I also think that I should point out to you that that you would normally argue, because you have to get an informed consent to euthanasia or assisted suicide, that would mean that all reasonable alternatives should be offered to the patient. And that would mean that palliative care must be available before you could get an informed consent to euthanasia. However, but there's Quebec legislation and the Supreme Court of Canada and the Canadian Medical Association have all come out expressly saying and putting in official documents, or in the Quebec case in legislation, that it is not a pre-requirement for having access to euthanasia that you have to have been offered palliative care. So you can have euthanasia without having the option of having palliative care. And we know from the research that even people who want euthanasia, when they're offered palliative care and they're given good palliative care, not all of them, but a very large percentage of them change their minds. And the work on this has been done by a wonderful psychiatrist called Dr. Harvey Max Chhatra, who's an unusual psychiatrist in that he specialises in psychiatry of dying people. So you want to keep that in mind. Okay, so here's strategy 2. What the Supreme Court of Canada did in legalising euthanasia, and what is the strongest case that the pro-euthanasia people use, is they focus on a suffering individual person who wants euthanasia. The media are particularly keen on this, and you've probably seen on the internet the case of the young American woman, 29-year-old woman with a brain tumour, and it was all over the internet and Facebook about how she was sitting there with her lovely cute puppy and saying, you know, all I want is euthanasia. And so that makes compelling television. And they focus on the right to choose, the right to life, and the cruelty. See, this is what matches the kindness. If euthanasia is kindness, then denying euthanasia is cruelty. And this is what we've seen happen in Canada. Now, in our constitution, under what's called the Charter of Rights, we've got the right to life, liberty, and security of the person. In this Carter case in the Supreme Court of Canada, it was fought on the basis that denying assisted suicide or euthanasia is a breach of all of those rights. And the Supreme Court of Canada agreed that it was. Now, it really boggles the mind to think how on earth could killing somebody be a breach of the right to life. But this is what the court held following the trial judge. They held that if you don't have euthanasia or assisted suicide available, then somebody who wants to know that they can control when they die, and they've got some disease that will make them unable to commit suicide without assistance or without a lethal injection, then they will have to commit suicide earlier than they would if they could wait until they can't do it, but somebody else can do it for them. And that is a shortening of their life because they'll commit suicide earlier, and that is a breach of the right to life. Now, that's what the Supreme Court of Canada held. And, I mean, when I first read it, I couldn't believe it. I read it in the trial judgment, and I thought, well, this is amazing. But the Supreme Court completely endorsed that. And here's what they say. It's a crime in Canada to assist another person in ending her own life. As a result, people who are grievously and irremediably ill cannot seek a physician's assistance in dying and may be, and this is very important language, may be condemned to a life of severe and intolerable suffering. In other words, suffering is not just something that happens, it's something if you don't kill somebody, you're condemning them to live that terrible life. And it goes on, a person facing this prospect has two options. She can take her own life prematurely, often by violent or dangerous means, or she can suffer until she dies from natural causes. And here, this is very important. The choice is cruel. So if having to not have access to assisted suicide or euthanasia is cruel, then providing them is kindness. And that's where that Globe and Mail headline comes from. And the last four words, the choice is cruel, tell us what the Supreme Court's decision will be, because that piece I just read you is the first paragraph of a very long judgment. And the court goes on to say the criminal code unjustifiably infringes the rights to life, liberty and security, and they're of no force or effect to the extent that they prohibit physician-assisted death for a competent adult person who clearly consents to the termination of life and has a grievous and irremediable medical condition, including an illness, disease, or disability, so they included everybody with a disability in this, that causes enduring suffering that's intolerable to the individual in the circumstances of his or her condition. And that last part is very important because all of the Canadian judgments have said that nobody else can judge whether it's intolerable to the person, only the person themselves. It's a subjective judgment. If they say it's intolerable, it's intolerable. And also the Quebec legislation says the fact that you could relieve the suffering but the person refuses the treatment for the relief of suffering is not a reason to deny euthanasia. So there we have it. So what the Supreme Court did was it turned to the stories of individual suffering and very difficult deaths and read them all out, used them from the trial judgment. But what was interesting is that the Attorney General who was opposing this, I was involved in helping to try and defend this. We also put in stories of people who said, no, this would have been terrible. You know, my mother would have been killed, and yet when she was treated properly and given palliative care, she changed her mind and she didn't want euthanasia. The judges didn't take any weight on those stories. They only took the stories that said, this is terrible. So I think we have to take those awful stories into account, but we've got to try and take the other side into account. Now, I don't know how you're going to do that we were really almost totally unsuccessful in Canada in getting that taken into account. Also, the trial judge's findings were, with respect, were factually in error. And we tried to get new evidence put into the Supreme Court of Canada, with the exception of one affidavit from an expert from Belgium who had seen what had happened with the law there, where it's this huge abuse. They let his affidavit in, but ignored it and refused to allow any evidence that would have corrected the mistakes of fact that the trial judge made. So that was also another problem. Now here's the third strategy, and this is really important. This is the no difference strategy. And what they argue is that euthanasia is just an incremental change, and it's no different from medical treatments that we already accept. And they say it's just a small incremental step along a path we've already taken. And what they argue is that that we turn off respirators, we give pain management, even though that might shorten life, although properly titrated, the evidence is that pain management probably extends life rather than shortens it. And they say, well, there's no difference between that which we regard as legal, as ethical and legal, therefore we should regard euthanasia and assisted suicide as ethical and legal, and not to do so is to be inconsistent. So the argument against that is that there is a major difference, that there is a difference between relieving suffering, accepting people's refusals of treatment, which is an acceptance of a right to inviolability, a right not to be touched without your consent, and killing a person, giving them a lethal injection. It's a difference in kind, not a difference in degree. And one of the areas where you get into trouble here is where you use what is called alternatively terminal or palliative sedation. And the reason you get into trouble is that occasionally, although with good palliative care, it's not necessary very often, the only way you can relieve their suffering, for example, with severe neuropathic pain that you can't relieve by any other means, you sedate the person. But when used for pain management or suffering management, and used in a way that has got no intention to kill the patient, and where usually doctors who use it allow the patient to occasionally come out of the sedation, that is what I would call palliative sedation, and it's a proper part of palliative care, providing it's indicated that that's what you should use medically. On the other hand, terminal sedation is really slow euthanasia, where you give, and this is what the Quebec Act has in it, they call it irreversible continuous sedation. And they say that you have to make sure that the patient understands at the beginning that if they're given this, they will be kept fully sedated until they die. And of course, what they do is withdraw of food and fluids, artificial hydration and nutrition, and usually the person dies at the outset in 2 weeks from dehydration or starvation. And that is done with the intention of the person dying. Now, the frightening thing about that under the Quebec legislation is that unlike the lethal injection that you're going to be able to have under the Quebec legislation, where you have to have given, at the moment, you have to have given your own personal informed consent, a surrogate decision maker can consent to this terminal sedation. They call it continuous palliative sedation. So again, they mess up what the terms are so that you're not quite sure what you're dealing with. So again, there's a big problem with that. Part of this same strategy is defining euthanasia as medical treatment. And there's a reason for that in Canada that you wouldn't have here. And what it is that federal jurisdiction does not cover medical treatment. Medical treatment is a provincial jurisdiction. So Quebec, because it wants to have this law, argues that euthanasia is medical treatment, therefore the federal government can't legislate on it, and therefore Quebec can legislate on it. And a colleague of mine, Dr. Donald Boudreau, and I have written an article in a journal, I think it's called Bioethics, published by Oxford University Press. So it's an okay journal. And we wrote this article, it's quite a long article, saying why euthanasia is not medical treatment. For one reason is physicians have never regarded it as such. In fact, they've always regarded it as something that they must never do. And also that it's irreconcilable with medicine's mandate to heal. And that's an extremely important factor in medicine. And and we've also argued that this would harm medicine's role in carrying the value of respect for life for society as a whole. Paradoxically, when religion no longer carries general values for society, medicine and law have become the two institutions that carry the value of respect for life, and therefore it's much more important to uphold that value in medicine and law than it was when we used to use religion as a major factor in carrying our shared collective values. And in this paper we wrote, because my colleague Donald Boudreau, it was Dean of Students at the medical school at McGill, so he had to think about, well, how are we going to teach medical students how to kill their patients? Which, it's not an easy thing to think about. And one of the things that we came up with was that we looked for when society had in the past ever authorized somebody in society to be a killer. So what we took was the Hangman's Bible from the turn of the century, from the 19th to the 20th century in England, and they used to have a special course to train their executioners. So we looked at that and said, well, what would that tell us about training our medical students? And we did it kind of tongue-in-cheek. We don't want to see this, but what we did it for was to try and have a shock value about this is what we're really thinking of legalizing here. Now, there's a lot more I could say about that, but I won't. Strategy 4 is and this is related to what I was just talking about, euphemizing euthanasia by calling it medical treatment and medically assisted death. And what we also suggested in that paper was that we've got to if we're going to have euthanasia, if society wants it, don't let's have it in medicine. Keep it out of medicine. So if you want it, let's have a new profession. We called it thanatologists, people who are specially trained to go around giving lethal injections. And why do we think this is necessary? Because if you're going to legalize assisted suicide, that endorses suicide as an appropriate response to suffering. And the people who are pro-euthanasia deal with that by saying, well, it's different from suicide because in suicide, you're not going to die unless you commit suicide, but these people are going to die anyway. Although that is not actually true in a lot of these cases. In some of the cases where people have changed their mind because they thought they were going to die, there's one case in Oregon, and the woman wanted to have assistance in committing suicide. 13 years later, she's really fit and okay and running around. And we've had a tragic case in Belgium, and I actually know the son of the woman that this involves. She was a 62-year-old woman. She had serious depression all her life. She was physically no illness at all. And she went to her psychiatrist and said, I'd like to commit suicide. And he said, well, I think that's a good idea. And she committed, he gave her the means to commit suicide. And the first that her son and her son's wife, and they've got 2 little kids, her grandchildren, the first they knew of it was when the hospital phoned the son, who's a university professor, and said, what would you like us to do with your mother's body? And he said, what do you mean? I don't know anything about this. And his name is Tom Mortier. And he's been terribly, terribly distressed about this situation because he was somewhat having a difficult relationship with his mother. He feels terribly guilty. And yesterday, there's an article in this month's New Yorker about this case. And so that's one of the risks of this. The other thing that's happening here is that the words euthanasia and assisted suicide are never used, because the pro-euthanasia people know, and we've got the results of this, that when they're used and they do polls about should we have this, the more you use those words, the more that people say no, we shouldn't do it. So in Quebec, they've called it medically assisted death. Well, we all want medical assistance when we're dying. And actually, the acronym for medically assisted death is MAD, MAD. And so I think that's something that we can sort of use. But also, there's a deeper reason here. New research about how we make ethical decisions by experimental psychologists, there's some fascinating stuff coming up, shows that we've got unconscious ways in which we decide what is ethical and what is not. And it's also showing that our intuitions, especially our moral intuitions, and our emotions, our emotional response to what we're thinking of doing, are very important factors in how we decide about what is ethical and what isn't. And so that's got a big connection to the language we use, because language evokes emotions and intuitions. And if we sanitize the language, we don't get the right emotional or intuitive response. So one of the things that I argue there is words matter. And then this is part of the same stream of strategies, sanitizing euthanasia by associating it with medicine. People think physicians are ethical. They think they don't act unethically. Hopefully that's usually the case. And what I suggest is that we need to take the white coat off euthanasia and assisted suicide, which is the same thing as take it out of medicine if you're going to have it. And we've got examples of this. For example, in the US, they made capital punishment. They wanted to have it, and they do have it, administered by lethal injection, and they wanted to have physicians do that. And that's because people think that when physicians are involved, it's much more likely to be ethical. And so I think we have to avoid that. I was giving a speech in Canberra, here actually, some time ago. It was the national meeting of the Australian Medical Association, and there were about 600 physicians there. And a friend of mine called Roger Hunt, he's given me permission to use his name, he's a palliative care physician in Adelaide. And he, unusually for a palliative care physician, because the statistics are about 92% of palliative care physicians are against euthanasia, but Roger supports it in some, fairly extreme circumstances. So I was banging on the table, I've forgotten which hotel we're at, and saying, we can't have doctors killing their patients. And Roger jumped up in the audience and yelled out at me. He said, Margot, would you stop using that word killing? He said, it's not killing. I said, well, what is it? And he said, well, it's VAE. And I said, well, what's VAE? And he said, well, it's voluntary active euthanasia. So I went on with this speech, and a bit later I said something similar to what I'm saying to you here tonight. If we're going to have this, keep it out of medicine. And one of the propositions that's been put forward is that we should, because you want somebody who can understand the law properly and apply it strictly. And the question is, who is trained to do that? And the answer is lawyers. That's who is trained to do that. So there's a suggestion that we should have a group of specially trained lawyers who will administer euthanasia. And with that, Roger leapt to his feet and screamed out at me, Margot, are you crazy? You'd have lawyers killing people? So you see, it makes a difference. So, but we've got to be very careful. As a matter of fact, I thought I was going to get into trouble because I am a member of the bar in Quebec, and as a lawyer, you've got to be respectful to courts, as my colleague Father Frank Brennan knows, although sometimes isn't. I suggested that, seeing that the Supreme Court of Canada had unanimously, and acting as the court, which makes it a very strong decision, had all said we have to have euthanasia, that we should train our Supreme Court judges to be the people who would do this. I don't think that went down very well. Okay, so strategy 6 is to label opponents and their values as religious and dismiss them and their arguments on that basis. And in the reports that have led to this situation in Canada, there's what's called a Royal Society of Canada report, totally pro-euthanasia, didn't have a single anti-euthanasia person on the committee that wrote the report. And in the Quebec Legislative Assembly report that has led to this act in Quebec, that is exactly what they've expressly stated. The Quebec report says something along the lines of Quebec used to be a religious society. It was about 98% Catholic, but now it's not, and that we cannot have any religiously based values for broad-based legislation. They don't apply anymore. So that's another thing. So you have to challenge when you're labelled religious and that you're only saying this because the Pope told you to say it. That's what I get accused of. I get accused of being a secret agent of the Vatican in Canada. But, you know, the thing is, I never, never, never argue from a religious base. And when I talk to religious people, this is more for the evangelicals than Catholics, and they start quoting the Bible at me, I ask them, who do you want to convince? Do you want to convince yourself? Okay, the Bible's good for you. Do you want to convince your co-religionists? Yep, you can talk about the Bible with them. But if you want to convince the people who disagree with you, there's no point in doing that. In fact, you immediately dismiss yourself and alienate them. You cannot talk from a religious base. That presents a huge difficulty. What we did in Canada, the Catholic bishops were advised to please keep out of the debate, because if you're in it, it'll get labelled religious, and we now wonder if that was a mistake. And since the Supreme Court has ruled on this, the Catholic bishops have come back in, and they're now looking at what they can do to handle this situation. But it's a very difficult situation. The 7th strategy is to appeal to empathy and compassion, which is what the Supreme Court did in reading out all these awful stories of awful deaths and awful illnesses. And I did a CBC television program recently, and one of the guys I was arguing against, he said he'd had 2 deaths in his family recently, his mother and his dog. And he said that one had a good death and one had a terrible death, and his mother had a terrible death and his dog had a good death, and that was because the veterinarian could give the dog a lethal injection. And of course, this is what Peter Singer argues, and this argument depends on saying that there's no difference between your mother and your dog. And the answer to that is, I think, that when you say, why do you euthanize your dog because you love him and you don't want him to suffer, but you don't euthanize your mother, the answer is your mother's not a dog. And I think I was asked a while ago to write an op-ed for one of Canada's, actually for the Ottawa Citizen, which is our capital city, and they asked me to write on what do you currently think is the world's most dangerous idea. And what I wrote it on was that there is no difference between humans and other animals. And that, of course, is Peter Singer's argument, that there is no difference, and that if you make a difference, that's a form of discrimination that he calls speciesism. So that's another area. Although I know Peter and I like him and he's a genuine person, it's just that we disagree on almost everything. So, and interestingly, he's honest, because his mother was an amazing woman called Dr. Cora Singer, and she was a Holocaust survivor, and I knew her too. And when she was well into her 90s when she died, and she had Alzheimer's disease. And Peter was being interviewed by Newsweek, and they asked him, they said, well, if euthanasia was legal, would you give your mother euthanasia? And Peter said, no. And they said, no, why not? And he said, well, it's different when it's your mother. So I think that's part of it. Okay, so strategy 8, and this is really interesting. This came up in the court case, and it was one I hadn't seen phrased so much in these terms before. And it was a colleague of mine called Professor Wayne Sumner, who's a philosopher, and he's another one that he and I disagree on everything. And we do television programs together. But anyway, he put forward this, what he called the deprivation theory, and the court actually accepted this and repeated it at great length in the judgment. And what it amounts to is that death is not a harm if it doesn't take away from you anything that's a benefit. And that if your life is only suffering, then life is of no benefit. You're better off dead, and life is not worth living. So it's a quality of life argument in different terms, and therefore taking away a life not worth living is actually a benefit to the person who gets killed. So that's another argument that's coming up. Now, just a brief analysis of the strategies. Okay, what does calling support for euthanasia a progressive value tell us? And I don't know whether you've come across this in Australia. Are people talking in Australia about progressive values? Oh, they are. I heard a Supreme Court judge from Canada just very recently. Actually, it was Judge Abella, and which Father Frank won't be surprised about. And we were in a closed conference, and she referred to some judges as restrictive judges. And so the opposite of that is permissive or progressive judges. And progressive values include a very, very heavy emphasis on individual autonomy, and it takes priority over all other values. It focuses on choice, and that's a very much a hallmark word of progressive values. You ought to, as an individual, to respect your autonomy. You should be allowed to choose whatever it is you want to do. I think it's a seeking of control mechanism, what some people call a terror reduction mechanism or a terror management device. And there I'm using terror in its general sense of intense fear, not terrorism. That's not what I'm referring to there. There are some social psychologists who've done some interesting work on this about how we can only live with a certain level of fear, and then we have to do things to try to get that fear under control. And one of my theories is that we used to deal with the fear of death through religion, but now that most people are not religious, you've got to have some other way to deal with the fear of death. And I actually think euthanasia might be a response to the fear of death, because we know that taking control reduces fear, which reduces free-floating anxiety. And so if you've got no other way to control your fear of death, you say, well, I can't avoid it, but I can get it before it gets me. I can choose the time, manner, place, etc. Part of this progressive values is a questioning of authority, which fits in with often a hostility to religion, because a religion is seen as being authoritarian. And and here I have another suggestion. Don't speak of the sanctity of life. As soon as you use that word sanctity, that can be labelled religious. Speak of respect for life and what is required for respect for life. And also you have to look at respect for life not just at the level of respect for an individual human life, but respect for human life in general in the society. And what does this do to that? And if you look at the judgments that have supported euthanasia, they have not considered at all what the other levels of respect for life require. And also it's part of the culture wars, because the same fundamental values are involved in the euthanasia debate as are involved, for example, in the abortion, the same-sex marriage, the access to drugs, no criminal prosecution, and which I don't think is, I'm not sure we're doing the right thing there in banning drugs, but that's another topic. But they're all in the same category. I think we also have to ask, what can we learn from history? And I prefer John Ralston Saul's term for history, which is human memory. What do we know? What about the fact that we're overriding 2,500 years of doctors must not kill their patients? And why now? Because there's nothing new about euthanasia. We always got old, sick, we're suffering, and we're going to die, and we could kill somebody. So why now? We have to think about that. We also know that if physicians turn into killers, there's a loss of trust in them. And there's also currently, not just in this area, but particularly in genetics and reproductive technologies, a search for perfection, for human perfection. And this is very contentious, but I mean, the best, sort of strongest example of that we've got is, of course, what the Nazis did. But now we've got tools that were not available to them, which is, something to be thankful for. But there was an article in the Danish press not so long ago that within 30 years, Denmark would have perfect people, because there would be no children born with Down syndrome. So if we see a perfect society as one that has got no people with disabilities, that's the sort of thing we're moving towards. And of course, there's a lot of new reproductive and genetic technologies that will allow us to do that. 2.5 weeks ago, I was at a conference in Atlanta, and we had a knockdown, drag-out battle with 400 invited people from around the world about whether we should do what's called editing the human germline. That is, you don't have to have the baby that you conceive. Once you have that embryo in a test tube, you can change its genes, and you can edit out the genes you don't want. In April, in 4 laboratories in China, they use this new CRISPR technology, which is a gene editing technology. And there's a huge contentious debate going on up until 6 weeks ago. Almost every bioethicist in the world thought it was ethically wrong to do this. Now it's possible to do it. And one of the problems is that the benefits of that are going to be put forward so powerfully that I think that it's going to be very hard for people to say no to it. So this is what we're facing. I've mentioned this really already, we have to look at the impact of legalising euthanasia, not just at that individual level, which is where the strongest pro-euthanasia case is, but also what will it do to the institutions of law and medicine? What will it do to our hospitals? Do you want to sit down with somebody to have lunch who 10 minutes before gave a lethal injection to a patient? And what will it do to our society? And not just in the present, but in the future. How will your great-great-grandchildren die if we legalise this? And one of the themes that I've been promoting recently is that we've all become very conscious, and Pope Francis has made us even more conscious, that our physical world is not indestructible, and that what we can do can wipe it out. Well, I suggest that the same is true for what I call our metaphysical world, the collection of values, principles, beliefs, attitudes, shared stories that we share with each other in order to form the glue of the values that bind us together as a society. And that too is not indestructible, and we have to think what legalising euthanasia would do to that. So I think that we have to react to pain and suffering with deep compassion and assistance to relieve it, but that we must kill the pain and suffering, not the person with the pain and suffering. If we go into euthanasia, we've got 2 very powerful examples of the slippery slopes that can't be avoided. The logical slippery slope is that once you allow this, originally it's for competent informed consenting adults, but it quickly goes beyond that. The current estimates are that at least 1 in 6 people in Belgium are euthanized without their consent. In the Netherlands, at least 4% of all deaths are by euthanasia. What you see is that euthanasia becomes a norm, and that once it's accepted, then the conditions in which it can be used are extended. The Netherlands is looking at whether if you're over 70 and, quote, tired of living, you should be eligible for euthanasia. They are using it for people with Alzheimer's. Belgium is currently debating in its parliament whether to allow it for people with Alzheimer's. Both the Netherlands and Belgium have extended it to children. In the Netherlands, if a baby is born with disabilities, the Groningen Protocol allows the parents to consent to the baby being euthanized, and children in both the Netherlands and Belgium can now consent to euthanasia. They had one prisoner in Belgium who said that his suffering was being imprisoned and he'd rather be dead than have to face life in prison. He got euthanasia, which made 5 other prisoners immediately apply for it, and the Attorney General of Belgium said no, prisoners were not eligible. So we've got one group that's been kept out of this. The reason is that once you've said it is acceptable to kill intentionally, and the original justification is that you have to be competent and in intense suffering, that quickly becomes you have to be either competent or in intense suffering, and then it goes on from there, and you can see it opening up. And once you open it up, you can't put it back in the bottle. And the genie can't go back in the bottle. There's a Dutch theologian he's been in Canada recently. His name is Professor Boer, B-O-E-R, and he was on the Netherlands Commission that approves euthanasia. He said he was originally in favour of it, and he's now going around telling everybody, don't do this, it's a terrible mistake, and he's resigned from the commission and he's trying to remedy what he sees as this terrible mistake. So it's a very, very serious issue. Also in the Netherlands, doctors are becoming more and more reluctant to do this, partly because they're finding that they suffer psychological damage from doing this. So the Netherlands has recently set up 6 mobile euthanasia units, which are ambulances with a doctor and a nurse and a technician who will go to your home and euthanize you. So it's a very serious situation. And then I think as well, and I'm coming to the end, this is a most unpopular topic, that whether you believe that euthanasia is what I call inherently wrong, that it's inherently wrong to act with a primary intention to kill somebody else, except the only exception is when it's the only reasonable way to save human life, which of course that's the situation in justified self-defense. But that's not acceptable because almost, especially the younger generations, are all moral relativists, and they don't believe anything is inherently right or wrong. They'll tell you, my students tell me this, well, it all depends. Even if you ask them, what about Hitler? They'll say, well, maybe he had some reasons, it all depends. And professors of my age, we freak out, but younger professors, they understand this is how the students see things. So, in conclusion, euthanasia is not just an incremental expansion of current ethically and legally accepted end-of-life decisions, such as refusal of life support treatment, as pro-euthanasia advocates argue. Acting with an intention to kill is different in kind from allowing a natural death. Euthanasia is not medical treatment. Defining it as such presents serious dangers to patients, the trust-based physician-patient relationship, medicine, and society. If euthanasia is legalised by society, we must take the medical cloak off it and have some specially trained persons other than physicians mandated to administer it. We need to ask ourselves, if euthanasia is permitted, how do we think our great-great-grandchildren will die? What kind of society will we have left to them? Will it be one in which no reasonable person would want to live? It seems that most politicians and many people in Western democracies, such as Canada and Australia, do not recognise the momentousness of a decision to legalise euthanasia. It's not an incremental change, but a radical and massive shift in our societies and civilizations' fundamental and foundational values. A prominent Australian politician who argued for legalising euthanasia captured the trivialisation of death that informs support for euthanasia in these words. He said, and I was listening to him, "As far as I'm concerned, when you pass your use by or best before date, you should be checked out as quickly, cheaply and efficiently as possible. But we're not products to be checked out of the supermarket of life. And what would be the cumulative effect of the use of euthanasia on vulnerable people? Consider, for instance, that Belgium is looking at allowing euthanasia for people with Alzheimer's disease, and that has not been ruled out by either the Supreme Court or the Quebec government in Canada. Indeed, in the reports on which they base their decisions, they say we leave that for a future date to decide. You don't do that if you think that euthanizing someone with Alzheimer's is inherently wrong. What would be the impact on our shared values that bond us as society and set the ethical tone of our societies? It's wisely said that we can't judge the ethical tone of a society by how it treats its strongest, most privileged and most powerful members. We judge it by how it treats its weakest, most vulnerable and most in need. Dying people belong to the latter group. I used to say that I cannot overemphasize how important it is for each of us individually and together to do all that we can to prevent euthanasia being legalized in Canada. But now, after the Supreme Court judgment in the Carter case, that's a forthcoming reality, although politicians could prevent euthanasia being legal by using an overriding clause in the Charter of Rights. It's called the notwithstanding clause, which would override the court's decision. Assuming that they don't, and I'm pretty sure they're not going to, we must try to get the narrowest and strictest legislation possible, as although physicians killing their patients is a legal possibility, we have to make sure it doesn't become a practical reality. I predict that history will see each society's decision about euthanasia as a seismic shift in values, one of two major turning point values decisions of the 21st century. Up until 3 weeks ago, I thought it was the only decision. I now think that whether we edit the human germline is an equally important decision. Thank you.